Well, let me ask you about what's at the crux of this. Democrats are demanding the funding bill include an extension of the Obamacare tax credits, as we've been talking about. They're set to expire at the end of the year. More than 3/4 of the people who get health insurance through Obamacare actually live in states that President Trump won in 2024. We're talking about some 19 million people, Mr. Speaker. Can those people depend on congressional Republicans to extend those health insurance tax credits by the time they expire?
We have plenty of time to figure that out because, again, it doesn't expire until the end of the year.
Do you commit to that?
I commit to what Republicans have always done and what we've already proven this year in the One Big Beautiful Bill, the Working Families Tax Cuts. Republicans are the ones in Congress working to improve health care access, quality, and make it cheaper. We want to bring the cost down of health care. Premiums are too high, but it's not because of Republican policies. It's because Obamacare is not working. We're trying to fix it. We've just shown in the One Big Beautiful Bill, the Working Families Tax Cut, those reforms we made to Medicaid are not cuts to Medicaid. Medicaid will continue to grow. It's just growing at a slower pace. Why? Because we got illegal aliens and able-bodied young men without dependents off of Medicaid. They were never planned to be there in the first place. And what the Democrats are demanding right now to keep the government open is we put them all back on there. We're not doing that.
This month, if the ACA tax credits do not go forward, which is what the shutdown is about, which I'm sure will loom large in New Jersey, viewers on this network who are 60 years old, making $75,000 a year, will see $841 increases monthly to the health insurance premiums. There's one party, and Mikey Sherrill, fighting to make sure that does not happen, and another acquiescing to Donald Trump, who in return shuts down an infrastructure project in their backyard, further hurting New Jersey's economy. I think that entire self-owning of Trump trying to own the libs, and by extension, hurting Citarelli, is going to play a big role in this race.
We've been talking about the Affordable Care Act, enhanced premium tax credits, and sort of the politics of it all, right? But this is a very real, tangible impact that American people will feel. The Kaiser Family Foundation says that with the ACA enhanced premium tax credits, without them, premiums will go up 114% on average. 19 million of the 24 million people who rely on the coverage are in states that President Trump won. Is he concerned what will happen to those families if this tax credit expires? And aside from the shutdown, is there a plan to keep those premiums down?
Look, as the vice president just said, we are more than happy to have this conversation. The president and the vice president and this team are more than happy to have that conversation with Republicans and Democrats on Capitol Hill. But it cannot happen right now. Right now, we need to reopen the United States federal government.
Here's the deal. Republicans have three choices. One is to work with Democrats on a bipartisan CR that ensures millions of Americans don't lose health insurance or see their premiums skyrocket. Two is for Republicans to do what Donald Trump said and pass the CR themselves. Republicans are in charge, after all. Or three, Republicans can shut down the government. And if they choose door number 2 or door number 3, make no mistake about what will happen. ACA tax credits will expire, and nearly 24 million people will see their premiums skyrocket by 93% on average. 93%. Now let me paint a picture. A mom and a dad in their early 60s, both have jobs. They make $80,000 a year combined. Right now, they can afford their health care, barely. But if these ACA credits expire, their bill jumps more than $17,000 a year. That's like a house mortgage. That's $1,400 a month, every month, just for the privilege of not going bankrupt if they get sick. Or take a family of 4 making $64,000. Their premiums rise by $2,600 a year. That's groceries. That's car payments. Now, it might not sound like a lot of money to my friends on the other side. Maybe the billionaires don't think $2,600 a year is a lot, but my constituents do, Mr. Speaker. And my guess is that millions of Americans will think that is a high cost to pay. Mr. Speaker, if these tax credits disappear, it is a 5-alarm fire. And Republicans are acting like they don't even smell the smoke.
Having those premiums jump by double, having your getting a notice in November that you're going to pay twice as much, does two things really fast. First of all, it terrifies everyone who are already paying too much for groceries and rent, and they're worried about their jobs in the future. But it also makes sure that the younger and healthier folks drop out immediately. They say, well, we can't afford this. We'll buy shoes for the kids or lunch money. And leaving in the insurance market folks who are desperate, are cancer survivors, or heart attack survivors, everybody's rates will go up. Everybody's rates will suffer, and you will have a older and sicker population in the insurance pool. That's not good for anybody. It's more medical bankruptcies, more times at the emergency room because people don't have the insurance coverage to go see a doctor in the first place, don't get preventive care. We know this playbook. This was in place before 2014. It's very familiar. We had some of the highest uninsured rates in the Western world. They're now at the lowest level they've ever been in the history of the United States. More people have health coverage, and that's a very good thing.
So if you look at what happens if they expire, it becomes a very different ballgame. 4 million people become uninsured almost immediately based on some estimates out there. Dramatic rate hikes would follow as well. How high would those rate hikes be? Well, if you were making $18,000 a year, not much, your current premium for this is $0. That's great, but then $378 is your new premium. $378 is the change. If you're making $35,000 a year, your current premium, $1,033. Your new premium, if it expires, look at that, more than double, so up. 15, almost 1,600. And if you're 55,000, 4,000 jumps up to 5,478, another giant jump there. And look at this on what they call higher earners. Imagine an older couple out there who's making $85,000 a year. That's not billionaires or anything like that, but that's a higher earner in this case. Here's their current premium, $7,225 per year. That's 8.5% of their income. That's sort of the top end under the current rules. Under the change, if it expires, that will jump to $25,000 per year. That's almost a 30% increase. That's almost 30% of their income, not an income, 30% of their income for the year. That's a tough thing if you're making $85,000 a year.
Republicans are attempting to use the government shutdown as a way to shield themselves from one of the most devastating realities of the big, beautiful bill, and that health insurance tax credits are going to be cut. At the end of the day, there's really nothing that Republicans can do to stop the majority of the public from realizing that the shutdown is their fault. The job losses, the cuts in places like the education department, it's because of Republicans. It's not just about partisanship and Democrats and Republicans can't come to an agreement. This is part of Project 2025. This is part of the agenda to shrink the federal government, which goes back even down to Ronald Reagan. This is not new. George W. Bush did it. Donald Trump did it in his first term, and he's doing it even more in his second term, even though he promised that he's not going to do anything to Medicaid. He promised that he's going to replace and repeal Obamacare. In his first term, never did it. He said that he has concepts of a plan for his second term. And of course he has none. They're just trying to cut everything, make things more expensive so that pharmaceutical companies and private health insurance agencies can make more money. It's nothing new. It's the same old, except this type of corruption is on steroids. I mean, Donald Trump is getting $400 million private jets from Qatar, and lo and behold, they're building an airbase on American soil. This is perhaps the most corrupt administration. Well, not perhaps. This is definitely the most corrupt administration in American history. And in modern history, it's definitely one of the more corrupt administrations in the world.